So I've been told I have lung cancer. Can you tell me what type of lung cancer I have?
It's important to take initiative and ask your provider what type of lung cancer you have. This may include the type of cancer. There are many types, including adenocarcinoma, squamous cell carcinoma, small cell carcinoma, and all of them have different treatment options. It's also important to know what stage lung cancer you're in. Stage 1, meaning that the cancer is small and hasn't spread to any other sites, whereas stage 4 means the cancer has metastasized, which means it's spread throughout the blood or lymphatic system to other sites.
How was my lung cancer diagnosed?
Ask your provider to show you exactly where your lung cancer is at on your CT scan. From there are several different ways we can obtain a sample for biopsy. One of those ways is called fine needle aspiration, where they use x-ray and go through the skin to obtain a sample for biopsy. Another way is called EBUS, where they go down the trachea into the lung and use ultrasound and camera assisted to obtain a sample for biopsy. After the biopsy is taken, they test the samples for several different markers for histology and biomarkers. And if they are positive, they can make a specific diagnosis. It's important to keep a copy of your imaging and your biopsy reports so that all providers that are involved in your care have access to this vital information.
So now, what are my treatment options?
Learning about what type of cancer you have will help us to identify what you can expect as far as cancer treatment. Cancer treatment is a multidisciplinary approach, which includes your pulmonologist, thoracic surgeon, general oncologist, and radiation oncologist. There are different ways that we can treat cancer. Sometimes surgery is involved, there's chemo, there's radiation, and immunotherapy. For advanced cancers and cancers that have been hard to treat, clinical trials may be an option.
So I'm finding my cancer treatments really stressful. Can you tell me some ways to relieve those symptoms?
Cancer is a serious health condition, and it may be overwhelming to take in at first. It's important to develop an action plan with your family and your healthcare providers, just in case the cancer treatments become overwhelming for you.
What will we do once I'm done with treatment?
After you've completed your course of lung cancer treatment, close follow-up is needed to ensure that the cancer is gone and that you remain in remission. Ask your provider how often you're going to need follow-up CT scans or PET scans, and as always, keep a copy of any and all imaging done.
There are different types of lung cancer that are found at various stages of severity. Each come with different approaches for treatment. Be sure to ask your doctor what your specific diagnosis is to gain a better understanding of your health condition.
In most cases, a biopsy sample is taken from the mass to examine and diagnose your lung cancer. This sample is obtained by fine needle aspiration or by endobronchial ultrasound. Histologic staining and biomarkers are used to identify the type of lung cancer you have. Keep a copy of your biopsy report with you.
Depending on your cancer, surgery, chemotherapy, radiation therapy, or a combination of these are treatment options. Some biomarkers, like PD-L1, can be used to determine if your cancer will respond to immunotherapy. Clinical trials may be an option if other measures are not effective.
Cancer treatment can be straining both physically and emotionally on the person affected, as well as family members. Develop an action plan with your family and healthcare providers to help cope with these stresses. Ask about services for nutritional, spiritual, financial, and physical support.
Once you've completed the course of treatment, your providers will want to follow up closely with you to ensure you remain in remission. This likely includes CT scans and PET CT scans on a regular basis. Don't forget to obtain copies of those scan results for yourself and your other healthcare providers.
Having a diagnosis of lung cancer can be frightening, but staying informed and connected with your multidisciplinary team will ensure the best outcome possible.